and welcome to The Insiders, our special edition of the Buildings of Tomorrow podcast, where we deep dive into real-life projects around the world and explore how digitalization is being implemented in the buildings industry. In today's episode, we will talk about how the healthcare industry can really jumpstart their effect towards sustainability, especially given the recent challenges such as the pandemic, bringing increased burden in hospitals and budget constraints while ensuring health and safety of patients. Our case of today involves Signature Healthcare, an award-winning health system comprised of Signature Brockton Hospital and Signature Medical Group. Signature Healthcare began working with Siemens to identify critical upgrades to the building's infrastructure at its primary campus in Brockton, Massachusetts, to ensure energy efficiency and comfort.
So for us, it really was a matter of how do we best utilize what was available to us at that point in time to make the important infrastructure improvements that were necessary to ensure that the building was able to go into the future.
As the improvement required a large amount of capital, together with Siemens' financial products and expertise, Signature Healthcare was able to fund the infrastructure improvement plan.
When we talk about the business, we have to talk about it through their operations as well, not just through revenue, right? And so you look at workflow, you look at energy efficiency, you look at resiliency of your energy source, all things that impact and affect quality of care.
The refinancing provided Signature Healthcare with the ability to implement the upgrades and over the long term, save energy through the infrastructure improvement. Joining us as our guest speakers today, we have Steve Borges, the Vice President of System Financial Operations at Signature Healthcare, and Anthony Casciano, CEO of Siemens Financial Services for the Americas. And without further ado, let's tune in with Jon and discover what this project is all about.
Thank you very much for joining us.
Morning. Thanks for having me.
Good afternoon.
It's an absolute pleasure. And before we dive into the conversation, maybe you could give us a very quick introduction on these two organizations. Steve, I'll go to you first for Signature Healthcare.
Sure. Thanks, John. Well, Signature Healthcare is comprised of two different organizations. We've got Signature Healthcare Brockton Hospital, which was founded in 1896, actually, and has about 216 beds. We're located 15 miles southeast of Boston, which is the mecca of healthcare. Our medical group has about 150 employed physicians and 550 affiliated physicians across a number of specialties. We serve a population of about 450,000 residents in 20 communities, and we serve a very diverse population. That requires special services such as interpreter services because of that diverse population. And we serve as a safety net community hospital to these communities, right? We're a disproportionate share hospital, which means that we serve a disproportionate share of the community that relies on governmental insurance, either Medicare or Medicaid. So we play a special role here in the community, and we're happy to serve that population.
Amazing. Thanks, Steve. And a huge challenge that I'm sure we're going to touch on a little bit that you just mentioned there with that disproportionate part of the community that you focused on. Anthony, Siemens Financial Services, what are you doing and what are you about?
John, thank you. Siemens Financial Services is the B2B lending arm of Siemens. We're a global business and with a core focus on project finance, corporate lending, equipment finance, and equity, supporting companies across the key sectors of healthcare, where we'll talk about today, but also in the renewable energy space, manufacturing industry, and services. So we're focused on corporates, large and small and medium size. So ability to travel with companies as they grow and develop their business plans. If you think of Siemens making technology with a purpose, I always like to say that we provide capital with a purpose. So again, as I said, we travel with companies on their journey. In this example today, it's the sustainability journey with Signature, but we've been working with Steve and with Signature since at least 2017. I think that was the time I met Steve in the offices, and we used our corporate loan product through our bond financing. We use our equipment financing for technology, and for today and for the sustainability in energy efficiency, we're using a project finance type product. So again, as Signature has had different needs, we've been able to travel and work with them in investment in the strategy.
Perfect. Thank you, Anthony. Thank you, Steve, as well. And you both touched on some really interesting topics that I think are going to connect very well with our conversation today. Anthony, you've been here with us today. Obviously, when we talk about how does healthcare jumpstart towards this sustainability journey, financing is definitely going to be a big piece of this. And you mentioned there are a few different options, and that journey as needs change. And I think that's going to be a bit of a common theme behind our conversation today, because we all know when we talk about healthcare, the last few years have brought some changes with them, which we'll have the opportunity to discuss. But I wanted to start with the importance of sustainability within the healthcare sector in general. Why are we here talking about this today? And Steve, I wanted to bring this to you first. Why is sustainability such an important topic specifically for the healthcare industry?
Sure. I think from our perspective and what our experience has been is we understand that just under 10% of the nation's carbon emissions is related to the U.S. health sector. And we know that in early this year, the Department of Health and Human Services, in partnership with the White House, issued a call to action for the healthcare sector to tackle climate issues. The goal is to reduce emissions by 50% by 2030 and net zero by 2050. And knowing that and kind of understanding what that potentially may mean, while I'm not sure it's been communicated yet, as I mentioned before, being a community disproportionate share hospital, my sense is that sometime in the future, Medicare may use the levers that they're able to kind of convince healthcare organizations to work on reducing admissions. I think I look at it as kind of a carrot and stick. They may change the conditions of participation and say, in order for you to continue to get full payment, you may have to reduce admissions. So I think there's the business side of that, which is ensuring we continue to get paid. I think on the expense side of that, we know that we're all having challenges in ensuring that we're able to lower costs and that we're able to achieve our budget goals. And I think being able to leverage the ability to look at new technologies that not only reduce emissions, but also reduce our demand for energy and at a lower price point. I think that's a great business reason to be working on this as well. And then from a quality of care perspective, I think something that may be a little less known because it's not as, I guess, pervasive as when you think about energy. There are things that we work on today from a quality perspective that I think are already leading us towards working on emissions more than what people may think about. Two examples that come to mind pretty easily is anesthetic gas, which is actually a very dangerous and poisonous gas. We on a regular basis are actually measuring for that in our ORs. And I think we want to ensure that our associates are safe. And so we also want to be checking that the techniques that our anesthesiologists and CRNAs are using are appropriate as well, right? So their techniques are sound in trying to limit the amount of gases that are being released during those procedures. And on another note as well is our work on patients that have pulmonary disease. We're working with them and have introduced navigators who work with patients both on the inpatient side of the house and as well as at home to teach them how to use things like their inhalers to ensure that they're properly using that and not emitting that gas into the air. So those are just a couple of examples why, from a business perspective, why it makes sense. And then as we're working to improve our quality and care of patients, we're also using that as a lever to kind of improve that as well.
Yeah, I understand. And two great examples that highlight a little bit the complexity of this topic. It's not a simple thing to look at sustainability holistically, to look whether it's decarbonisation, energy efficiency, or whether it's the quality of operation and the continuity of operation that enables you to be the most efficient that you possibly can be. There's all of these factors build into it. And that leads me to that question for you, Anthony, is you have these kinds of conversations with customers such as Steve. How do you see these kinds of topics growing in the market in those conversations, and how does that journey look as you start to try and work out what you do and how you start to address these kinds of complex issues?
Yeah, John, great question. I think back to the first conversations we had with Steve, and we would talk again about, as I said before, the strategy of the business. We would look at where CapEx was going, and you would think of CapEx, moving toward new healthcare technologies, the latest MR or CT, or what would help improve outcomes. And that at its core still remains the primary responsibility of a hospital to deliver quality care. But they're businesses, right? Steve runs a business. And so while you look at revenue and you look at top line, you also have to understand cost and where cost is built. And Steve mentioned a statistic, and I like to throw out some statistics too. If you looked at healthcare in the aggregate, it consumes, if it were a country, it would be I think the fifth largest country behind the US, China, Russia, and India in terms of energy consumption. So you can't ignore in cost how you consume energy. And you look at Signature, and Signature, I know, Steve, it's a 130 plus year old hospital system, a hospital in Brockton. It certainly wasn't built with the latest and greatest innovative technologies. And so how do you just don't drop a new hospital, so you have to improve what you have. And I think when we talk about, with folks like Steve, when we talk about the business, we have to talk about it through their operations as well, not just through revenue, right? And so, and I know we'll probably talk about COVID, but you look at workflow, you look at energy efficiency, you look at resiliency of your energy source, all things that impact and affect quality of care. And so there's a connection point. We talk about what's important for the environment, climate change. It doesn't mean it's bad for business. And I think that's there's an intersection point where it can be good for the environment and also good for business. Steve is proof of that. There's a return on investment, and it can be felt in a multiple of ways.
Yeah, absolutely. And I think that's exactly, this is the core of our discussion today, and also the core of this partnership where you can see already that long-term conversation, that long-term partnership enables this kind of understanding. And I'd like to go back, Stephen, because Anthony just mentioned COVID, and no surprise, it's going to be one of my questions soon, but I don't want to ask it yet because you started this journey before COVID came along.
We did.
What were some of and you mentioned a few before, and between both of your inputs already, we've talked about the environment, we've talked about climate change, we've talked about what society expects, the impact of the healthcare industry as a whole, fifth largest country, if we put it in that scope, from an energy consumption perspective. Steve, you also mentioned some of that regulatory and let's say I wouldn't call it pressure, but what we'd see as governments helping make decisions and provide guidance to help push in the right direction. How did this begin for you? What was the journey like as an organization to get to this point?
Sure. So as John mentioned, we are a 130 somewhat old organization. And that kind of actually launches the conversations that start to take place in 2015 and in 2016. Again, I continue to say that we're a small community hospital. And one of the challenges in being an organization of that size is that there is limited capital. And so on an annual basis, there are discussions around, well, how much of our capital will be used for infrastructure and facilities, and how much is going to be used for the latest and greatest technology so that we can provide the best service and quality of care for our patients. And so those become more and more difficult as the building continues to age. And so I can tell you our experience was the facility and infrastructure really was driving the need to have to upgrade our facilities. But knowing that we had limited capital, we knew that we had to think outside of the box. So how is it that we could get new technology and take advantage of the savings in putting in newer technology that we could then either reinvest into the organization or at least help to pay for those technologies. So for us, it really was a matter of how do we best utilize what was available to us at that point in time to make the important infrastructure improvements that were necessary to ensure that the building was able to go into the future. So it really was more of a sustainability of our own organization that led us to start having these conversations.
Which is also a great phrase here. It's sustainability, and this links back to what you said, Anthony. Sustainability is not sustainability for sustainability's sake. It can be profitable. It does have an ROI. It does have a value to you as an organization to make you to ensure that you continue. That you have that continuity that you wish for as a business.
Now, if you don't mind, can we hang on that point for a second? Because Steve mentioned something earlier, and I want to respond to what you just said. At some point, this is about a company, and I call a hospital a company in the same way I'd call a manufacturing company, right? This will be about competitiveness. This will be about a business's ability to thrive and to continue. And so, Steve, you said earlier that you look at investors and lenders and where's capital going to come from. Lenders absolutely look through the lens of sustainability. It will be availability of capital, and it will be the price of that capital. There'll be different pricing based on your demonstration that you're driving energy efficiency. You're looking at and ensuring that from an ESG lens, that you're doing those things that matter. So that will affect your business ability to compete. Just again, from an operational perspective, how you use your energy to provide continuity, resiliency, manage workflows, all the different things that go into energy consumption, that goes to the bottom line. So a hospital, I don't expect, Steve's going to go out of business. The quality of care, the access to capital, the ability to invest in strategies will be.
Correct.
Sorry, John.
No, please. This is exactly what we're here for, because that context, this is why you're my experts, and I am here for this. Steve, you had this challenge, you had this journey, you already begun, and then COVID came along. In the simplest of terms, what did COVID put on top of the pile that was already quite high, and you're already struggling as an organization to think outside the box and find ways to implement?
Yeah, I think as we all know, no one had a playbook on their shelf about how to handle a situation like COVID. We started to feel the impact of COVID early in 2020, and it lasted a good 2 years and was very difficult, not only for the community and actually the world at large, but from even the internal community within the hospital itself. It put a significant amount of pressure on the day-to-day lives of folks who were leaving their loved ones at home and coming into work to care for those that needed to be cared for. So in addition to the stresses of coming into the energy pull that was required to care for those patients, I think sometimes may go unrealized as well. So one of the things that needed to be done pretty quickly was establish negative pressure rooms for these patients to be cared for, right? And so luckily we had put into place some of the energy improvements that helped us with that. But things like putting negative pressure machines in a number of different rooms in an aging facility, which creates an opening in a wall. And in the wintertime, during a snowstorm, it's great to have all that cold air coming in while you're trying to ensure that you're creating a negative pressure room for that patient to be cared for. So there was definitely an increase in the need for us to really think about how we could care for patients under those very difficult conditions. I think coming out of COVID, what we're all facing today is the impact of what seems to be a workforce that's disappeared. And that has increased the pressures as it relates to trying to be competitive in the marketplace to try to attract good talent to come and work for us. As I mentioned, we're only about 15 miles southeast of Boston, which means as a community hospital, we're also trying to compete with Boston rates, right? And there's no way that we're going to be able to sustain those rates and continue to be competitive. And it's important to understand that a nonprofit doesn't mean that you can't be profitable. It's important for us to be profitable in order to reinvest into our organization in capital improvements and in staff as well, right? So COVID in a number of different ways just added pressures to what is already a difficult industry in what I say trying to turn a buck, right? I know the thought is that most healthcare organizations are making money hand over fist, and that's actually not necessarily true, and especially not for community hospitals. So it was just additional pressure on trying to continue to do the day-to-day work that we need to do.
Understand. So extra pressure, so many things dragging on energy, extra activities, extra action that needs to be taken on top of an area where you're already looking outside the box to continue to invest in the best healthcare possible, deliver that service to the community, and hit these sustainability targets, control the costs of your operation, et cetera, et cetera.
Right.
Anthony, a story and a situation that Steve describes is something that this is why we're here. This is why the healthcare industry is such an interesting conversation. How does that look from your perspective, as the leader of an organization that delivers these different business models, these different options? What opportunities does that provide? What does that open for you as far as doors go to have conversations with Steve and other people like him?
I mentioned earlier that, I think we provide capital with a purpose. And I think during COVID, I never understood that in the ways that I did then. We would take calls, my teams, and healthcare is a big part of the overall Siemens Financial Services portfolio. We finance the local community hospital all the way up to the largest hospital systems. And we were on the phone all hours of the night with hospital CFO, hospital leaders, talking about how they made sure they had the capacity, the capability, the capital to make sure they keep the doors open, that they could deliver the services in its most acute way. And so we're talking about working capital, and can we give them, make more available to them, or how can we extend terms, or the different ways that we could partner together to make sure they were able to respond to the needs. And I have to tell you, from where we were locally through the leadership at Siemens globally, we would turn answers around in 24 hours, where it might take us 2 weeks, right? Because everyone had a role in solving this problem. And you look at it, and Steve's exactly right. We all have friends and family that somewhere operate in the healthcare space, and you'd watch them come home from a shift at the hospital and quarantine themselves in their own home because you didn't know enough about COVID and you didn't want to spread it in your own home, right? And so the work that the front lines, the work that they did, how could we not travel with that? And that's where I think expertise, knowledge, and commitment to the space matters. The other thing I would say is, you come out of COVID, and it's not where, hospital beds are full, you think hospitals make money. That's not where hospitals make money, right? Length of stay is longer. The type of service is not the higher revenue, higher margin type things like cardio or neuro, right? This is the most basic quality of care. And so coming out of it, you look and say, well, has revenue and margins caught up, but also from a staffing perspective, right? Because, and Steve mentioned it, we now have a massive nursing shortage, right? The skilled labor in healthcare has really suffered coming out of COVID. And so again, bringing it back to business, how do you manage workflow? How do you optimize resources? Who would have thought we'd be talking about CapEx and where money gets allocated in ways different, capacity utilization in ways different than we were talking about, outcomes and other things. So I think that all kind of is a derivative of what we've learned and what we're learning coming through COVID.
Understand. And it's such a great way to summarize the input from both of you, because such a challenging situation that put in factors that we could not have even imagined, that completely changed the perspective. And that example you just gave there, Anthony, of your team reacting to the essential requests at a short term, that for me really personifies the topic for my next question, which is that partnership. This is not calling someone a faceless person at the end of a line and saying, I'll sign the contract now, send me that money we talked about. This is every day, every week, every month over the last years. And like you mentioned earlier, Steve, since 2017, together here, working on changing requirements, working on daily operations, and in some cases keeping the lights on, and in other cases investing for the future. Huge pillars to build a collaboration and a partnership on. And my question around that partnership, and we've talked now, let's say, about the story and the journey that you went through, Steve. What did this partnership and what have these different approaches? You went outside the box, you talked with Anthony and his team. What have these different approaches enabled you to achieve? What's the outcome been for you at Signature Healthcare?
So in actually preparation for today's discussion, I actually went back and looked at and asked for what our most recent results were for the upgrades to our infrastructure that we did early on with Siemens. I'll call that our first project, as we're working on some additional projects today. But our construction period was from December of 2017 through August of 2019. And so this would be actually the results of our annual third period coming out of construction. And I was actually very pleased to see that our results were actually, for this third year period, 14% greater than what we had anticipated and what the targeted savings were. And so for an organization as ours, just slightly less than $350,000, that's a significant impact. And that's just the delta between what we anticipated and what we actually achieved, right? So that's significant to our bottom line, and that makes a difference. And just to think about that, depending on the level of skilled person that we're looking for, from housekeepers, that could mean a tremendous number of housekeepers that we're now able to keep. That could be a few providers that we're able to now keep. So just that level of improvement in our bottom line allows us to do many things that we otherwise would be very challenged to continue to be able to do. And if I could say one more thing, which I think is very important as you look for a partner, I had the benefit of sitting temporarily as an interim CFO for 8 months in 2019. That was a difficult year for Signature, and I think it was very important to have a partner like Siemens, who, as Jon alluded to before, deals a lot with healthcare organizations, right? And so we're a special kind of organization. We have seasonality that impacts our financials for an organization as ours. And again, I put out there that there were a disproportionate share hospital. When there are state budget crises, that impacts Medicaid payments and allocation of dollars to the organization. And similarly, when there are federal government budget issues, Medicare payments can be delayed as well. So it just makes it that much more important to have a partner that understands the difficulties and the timing of what that might look like in any fiscal year. Our fiscal year runs from October to September. And so it would be great to think that things kind of are even across those 12 months, but they're not. And so to be able to have a partner that understands that and knows the different variables that impact healthcare organizations is extremely important. And we were lucky to have someone like Siemens to be able to work with.
Yeah, thanks, Steve. And you mentioned there before, I think it was Anthony that made that connection of, let's say, having the experience and the knowledge within that healthcare space. And I bring that question back to you, Anthony. How how important from your perspective is that partnership and knowing the business and knowing the goals and the special situations or the unique situations that Signature Healthcare have. How important is that to you and your team as you build this long-term collaboration?
Yeah, John, we're not great in a commodity world. So if you want a bucket of cash, there's a lot of lenders that will provide a bucket of cash. But if you really want to look and get underneath the way a business operates, and we talk about, again, I said at the beginning, and I'll say it now, there's Siemens Health and Airs in there. There's Siemens Smart Infrastructure in there. There's Siemens Financial Services in there. There's really just Siemens in there, right? It's Siemens. And we're able to deliver, I hope to Steve's satisfaction, a turnkey solution, but a turnkey solution, not selling a product there, but selling an investment or bringing an investment into the most important ways that Steve needs to run the business. Again, whether it's supporting the top line, whether it's managing OpEx, whether it's ensuring continuity of care, resiliency of delivery, I think that's where we connect. But that's where I think Siemens is able to connect. I have here the write-up, our financial report that we do when we make a decision to invest. And there's 40 pages in there. And 2 pages or 3 pages are on financial modeling. The rest is about the business. The rest is about how Steve and the team are building tentacles to other providers in cardiology. Because you're 200x beds, Steve, but you're several hundred physicians that support through your network of relationships. The fact that we can understand that, the fact that we can have a conversation about that helps us target the best ways that we can provide solutions.
Love it. Both of you, thanks so much for the conversation. It's been really enthralling. It's been engaging. And I think because it's such, when we talk about healthcare, when we talk about a community hospital, when we talk about, the way that you put that energy or that cost saving, Steve, into the context of reinvesting in services that are then helping people recover, helping people heal, helping families come back together, it hits a little bit different than when we talk about a spreadsheet and when we talk about just tons of CO2 and things like that. So I think it's been a really great conversation, which I thank you both for. And to finish, I'd like to give you the opportunity to highlight those key topics from your perspective. When you look back at these last 5 years of collaboration, when you look at the challenges that are in the healthcare industry and how you together, your teams together, have overcome some of those challenges and delivered some of the results that you highlighted for us before, Steve, what are the key topics that you would pass to those listening or watching us to remember, to take into mind and to take with them? And Steve, I'll come to you first.
Sure, thank you.
For you, what are those key topics?
Yeah, I guess I would say that leadership is important, right? You've got to ensure that you've got leaders in the organization, CEOs, board of trustees, that understand the need to continue to look for technologies that will help put us in good position for the future, right? And that also includes ensuring that we have innovative facility leaders as well, who can think outside of the box and know enough to be looking for those opportunities where they exist so that we can bring them in-house. I think secondarily, I would say that the lift required to improve emissions is probably not as high or as difficult as people may think, especially in the healthcare industry, because there are so many regulations that we need to follow, that we're probably doing many of the things that would be required and are already lining up to try to make improvements in emissions of any impact into the environment. And I guess thirdly, and I'm glad that we have Anthony here, and Anthony was part of this discussion, is I can't stress enough the importance of a partner, a good partner that understands what our business is and why we're in business. We're not in the business of generating clean energy. We're not in the business of financing. We're in the business of taking care of patients, right? So we need to make sure that we have business partners that understand what our mission and our vision is, and are willing to work with us to make headway into ensuring that we're a viable organization into the future.
Perfect. Thank you, Steve. Anthony, same question.
Yeah, I think picking up on where Steve ended, Siemens obligations, Siemens goals are to ensure and be in a position to make sure Steve and Signature and those like Steve and Signature remain competitive into the future. And you think of healthcare and you say, well, what does that mean, be competitive? Because they're serving society, they're bringing care. And so, do they get an exemption from that? But they don't, right? They're a business, and Steve's a not-for-profit business, but he's still looking to build capital to be able to continue to invest. And so I think the products that we deliver are those that help to ensure that long-term viability, that long-term success. And the thing that's important to note is there's really no turning back. Where Steve is, and I consider Steve and Signature a leader in this movement, others will follow. And so for us, it's important to make sure as they take that journey that we can travel with them. Again, we talked about what carbon emissions are in healthcare, and they're significant. And most of the carbon emissions are coming around operational types of things, from the parking garage to the labs to the equipment storage, whatever it is. They consume a lot of electricity, and where there's a lot of electricity, where there's a lot of carbon, there's ways to reduce it, and there's ways to create efficiency, and there's ways to improve and deliver quality of care. It can all work together, and I think that's really the goal. And if anything, Signature is proof of that it works.
Perfect. Steve, Anthony, a great conversation, really good fun for me. I hope for you as well. But from the team and myself, a big thank you for joining me, and thanks for spending your time with us.
Awesome. Thank you, Steve. Good to see you again.
Good to see you.
So for everybody else who's listening, please remember to like, share, comment on this episode, subscribe to us, no matter which platform that you are looking for. And always remember, every second week, you'll see something new from us. But please take the opportunity, reach out, have a chat, have a look, have a learn about Signature Healthcare, especially if you're in the Boston area. And of course, also take the opportunity to check out Siemens Financial Services and some of the great service and financial support that they can bring out into the industry. Until next time, please enjoy and stay safe, stay healthy, and we'll see you very soon.